Students, I'm Dr. Siddharth Sethi, and I'll be discussing the AIMS November 2020 Pediatrics with you. Now, the questions which came in the AIMS November were all integrated questions. So, you would have questions which would be related to both PSM and pediatrics, surgery and pediatrics, psychiatry and pediatrics. So, you need to have a full grasp of the subject to know these kind of questions. And first question which I'll be discussing with you is regarding the immunization in a child who is on steroids. So there was a child who was a steroid dependent nephrotic syndrome, and they asked about which vaccines can be given, which vaccines cannot be given. So in all of my classes, I always discuss about the guidelines which we wrote about nephrotic syndrome. I'm a pediatric nephrologist, and way back in 2008, March, we wrote the guidelines for nephrotic syndrome for our country. And I was one of the guideline makers. Now, in every class of mine, I do discuss about the nephrotic syndrome in children. Now, you need to know what we wrote in the guidelines at All India Institute. Who is immunocompromised in nephrotic syndrome? Now remember, any child who has received more than 2 milligram per kg of prednisolone for 14 days or more than 20 milligrams in the last 6 months. So any patient who has received prednisolone more than 2 milligram per kg for 14 days or a total more than 20 milligrams is considered immunocompromised. Now, which vaccine can we give to an immunocompromised patient? So remember, of course, all killed vaccines can be definitely given. But remember, ideally, we give vaccines when a patient is on minimal possible steroids. Minimal possible steroids, or if you have stopped steroids. Now remember, of course, you will not give live vaccines. Do not give live vaccines. You can give all kill vaccines. Now remember, pneumococcal is the most important vaccine in nephrotic syndrome because the most common infection in nephrotic syndrome is spontaneous bacterial peritonitis by pneumococci. So we wrote in our guidelines that a child less than 2 years should ideally get 2 to 4 doses of pneumococcal conjugated vaccine. So every child who is less than 2 years should get 2 to 4 doses of pneumococcal conjugated vaccine. Now, after 2 years, we recommend that children should get a pneumococcal conjugated vaccine followed by a polysaccharide vaccine, followed by an interval of 8 weeks. So, if possible, you can give both. So, remember, we give a conjugated dose followed by a polysaccharide vaccine, an interval of 8 weeks. Now, if a child is more than 5 years old, you can directly give a polysaccharide vaccine according to our guidelines of Indian Society of Pediatric Nephrology. So remember, pneumococcal vaccine is very important. All children with nephrotic syndrome should get a pneumococcal vaccine. Now, you cannot give a live vaccine. Once he is off steroid, you can give a varicella vaccine. Now, they talked about the household contacts. What do we give to healthy household contacts? So remember, red book is a very important book which we very commonly refer. So it talks about what about household healthy contacts, can they take vaccines? So remember, oral polio vaccine is the only vaccine which should not be given to healthy contacts of immunocompromised patients. So we should not give the oral polio vaccine. Remember, you can give MMR to healthy household contacts. You can give varicella even to healthy household contacts. It has been seen that the MMR virus, the varicella vaccine virus, they are not transmitted by healthy contacts. So coming back to the question, so remember which statement is true out of these. So yes, of course, you cannot give all vaccine to this child. You can only give kill vaccine. Healthy household contacts should not be given OPV. You can give them MMR or varicella. Pneumococcal vaccine is a very important vaccine for a child with nephrotic syndrome prior to the treatment. I will be discussing more questions of pediatrics in the further series. Thank you.